Hello, Miss Blake. My name is Alita. I'm going to be your nurse today. I'm going to be doing a head to toe health assessment on you. Before we get started, I'm going to go ahead and wash my hands. Health assessment includes four things. It includes inspecting the body just to see if there's any lesions or any masses going on. I'm also going to be palpating around areas just to see if there's any tenderness or any pain or any nodules or anything abnormal that I'm feeling. The third thing that I'm going to be doing is I'm going to be percussion. Percussion is percuss over the organs to see if there's any fluids in there. The fourth thing I'm going to be doing, I'm going to be auscultating with my stethoscope, listening around to hear, make sure everything is okay. Miss Blake, first thing I'm going to be doing is I'm checking Mrs. Blake's appearance to see how she looks, how she's groomed, to see her facial expression, make sure she's happy, see if she's happy or sad. Also checking to see how her posture is and her movement is. Miss Blake, I want to ask you a few questions. What is your name and date of birth?
Cassidy Blake, and my date of birth is 7/1995.
Okay, I'm doing her just to make sure, make sure this is the right and correct patient I'm assessing. Now I'm going to start with her head. I'm looking at Miss Blake's head just to see the symmetric of it, make sure it's not she's not twitching, she doesn't have any tremors. Checking her face to make sure that there's no drooping or any drooling or anything going on. The other thing that I'm going to be doing is I'll be assessing her head. I'm going to be palpating around. And Miss Blake, tell me if you have any pain while I'm palpating. While I'm palpating, are you having any pain, Miss Blake?
No.
I'm checking her hair as well, just to see if there's any lesions in there, any nits, any patches, any bald spots or areas going on there in her head. The other thing that I'm going to be doing is I'm going to be checking her ears. I'm going to look inside of her ears just to make sure there is no wax buildup. I'm going to look on both sides. That's good. I'm going to also do another thing, Miss Blake. I'm going to whisper in your ear. I'm going to say something I want you to repeat for me.
Hello. Goodbye.
Okay. Also, I'm going to be checking in your eyes, Miss Blake. I'm going to check your pupils just to make sure that they're constricting. Constriction is normal for the eyes to do. That's a normal sign neurologically that her neurological status is good. Good constriction. Also, Miss Blake, with my finger, I'm going to check your nostrils just to make sure that you're able to breathe and make sure your nostrils are patent. On this side, I'm also doing the other side. While we're here, Miss Blake, I'm just going to have you open your mouth. Just me